These risks are not theoretical. They show up in real-life stories that families experience every day. For example, a woman in her early 70s might begin taking a sleeping pill, such as temazepam. The first few nights feel wonderful, deep sleep, peaceful rest. But after a few weeks, her daughter notices subtle changes: forgetfulness, slower walking, difficulty focusing, and grogginess in the morning. One night she wakes up, tries to walk to the bathroom, and loses her balance. A fall, a hip fracture, and an 80-day hospital stay follow. The cause was not aging yet, was the medication weakening her reflexes and slowing her reaction time. In another case, an older man might take a common allergy pill like Benadryl to help him sleep. Within weeks, his family may believe he is developing dementia because he becomes confused, misplaces everyday items, and repeats questions. But when the medication is stopped and replaced with safer alternatives, his clarity returns. These stories demonstrate how quickly a harmless-looking pill can disrupt a senior's life. Even a simple pain medication like tramadol can trigger a downward shift. A man in his late 60s could take tramadol after a minor fall or knee pain. Soon after, he becomes unsteady, dizzy, unusually tired, or mentally foggy. His wife may assume the fall caused these changes, but the real issue is the medication slowing his nervous system. Once the dose is reduced and safer therapies like physical treatment are added, his condition improves. These examples show how one drug can trigger a domino effect. Brain fog leads to forgetfulness, which leads to skipped meals or risky mistakes in the kitchen. Drowsiness leads to falls. Constipation from pain pills leads to hospitalization. Dizziness causes blood pressure fluctuations, and confusion results in seniors taking their pills incorrectly, sometimes double dosing themselves. Families must learn to recognize warning signs that medication may be causing harm: sudden memory loss, confusion, repeating questions, new anxiety, irritability, unsteady walking, dizziness, sleeping too much, or becoming socially withdrawn are often signs of medication overload, not aging. A loved one who was active and alert may suddenly seem distant, sleepy, slow, or forgetful. These changes should never be ignored. If you suspect a medication is causing problems, the first step is to make a complete list of everything the senior is taking, including prescription drugs, painkillers, sleep aids, vitamins, and herbal supplements. Bring this list to a doctor or pharmacist and ask directly whether any of these medications might be unsafe for someone over 65. Requesting a deprescribing review is extremely helpful. This is a careful process where a doctor evaluates which medications can be reduced, replaced, or safely removed. When medication adjustments begin, it's important to monitor the senior closely for a week or two. Families often notice immediate improvements in mood, energy, balance, and memory once the harmful drug is reduced or replaced. Seniors may become more alert, more present, and more independent. And as a caregiver, your role is invaluable. Many older adults suffer silently because they do not want to complain or worry their families. They mistakenly believe confusion, forgetfulness, or sleepiness are signs of aging, when in fact they may be side effects of medications that are too strong for their current age. If you are taking the time to learn this information, you are already protecting your loved one. You are preventing unnecessary suffering, preserving their independence, and helping them live with dignity. Awareness can be life-changing and, sometimes, life-saving. Even one safer medication decision can prevent a fall, avoid confusion, or protect memory. You are making a difference simply by understanding the hidden dangers and knowing what to watch for as adults move deeper into their late 60s, 70s, and beyond. One of the most important, but often overlooked topics is medication safety. Most seniors take more medicines now than at any other point in their life, yet few people stop to ask whether these medications are still necessary, still safe, or still appropriate for an aging body. Many prescriptions were started years ago, perhaps after an injury, an infection, a stressful period, or a single health event. Over time, these medications simply stayed on the list, renewed automatically, year after year, without a full review. This carryover effect creates a situation where an older adult may be taking drugs that were once useful but have become harmful with age. This is why medication reviews are not just beneficial, they are essential for every senior. Families often underestimate how dramatically a small medication change can improve an older person's quality of life. A senior who has been sleepy, low energy, or mentally foggy for months may actually be experiencing the cumulative effects of one inappropriate drug. When that medication is gently reduced or replaced with a safer alternative, the transformation can be astonishing. People who seemed withdrawn begin participating in conversations again. Those who struggled with balance start walking more confidently. Loved ones who appeared confused or forgetful regain clarity and interest in daily life. These improvements do not come from magic. They come from allowing the brain and body to function without the heavy burden of sedating or confusing medications. One of the biggest challenges is that seniors rarely complain about side effects. Many grew up in a generation that trusted every prescription without question, and they often assume that discomfort, dizziness, memory problems, or fatigue are simply signs of old age. They don't want to alarm their family, and they don't want to seem like a burden. As a result, they quietly endure symptoms that could be easily corrected. This is why the responsibility often falls on family members to observe changes and ask gentle but important questions. When a normally sharp and alert loved one becomes forgetful or sleepy, it's not disrespectful to investigate is an act of love. Another critical point is that the majority of seniors see multiple doctors. One specialist might prescribe a medication for sleep, another for the bladder, another for pain, and another for blood pressure. Each doctor may believe the medication they are prescribing is safe, but when these different drugs interact inside the same aging body, the results can be unpredictable. A medication that is harmless on its own may become risky when combined with another. This is why creating a complete medication list and bringing it to every appointment is incredibly important. Doctors can't protect a patient from drug interactions if they don't know everything the patient is taking. For example, many older adults develop a slow, subtle drowsiness that nobody questions. They may nap more, walk slower, or withdraw from social activities. Families may assume they are simply slowing down, but in countless cases, this fatigue is the result of medications interacting. Sleeping pills combined with pain medication, or allergy pills combined with antidepressants. The mixture creates a constant fog that the senior becomes used to, even though it is not normal. When their medication list is simplified and unnecessary drugs are gradually removed, they often feel more energetic than they have in years. There is also the emotional side of medication overload. Many seniors experience quiet anxiety, sadness, or loneliness that they never express openly. They may feel unsettled but can't pinpoint why. Certain medications can intensify these emotions without the senior realizing it. A drug intended for sleep may create morning anxiety. A pain medication may worsen depression. Anticholinergic drugs can create irritability or restlessness. Families who believe their loved one is becoming difficult may not realize that the real cause is chemical, not emotional. When medications are carefully reviewed and adjusted, the senior's personality often brightens again. Caregivers play a vital role in this process because they are the ones who notice subtle changes first. They witness the small shifts in behavior, mood, mobility, and awareness. These clues are valuable information for doctors who rely on family observations to understand how medications are affecting the patient. A senior might not mention that they feel dizzy in the mornings or that they nearly fell last week, but a caregiver often sees it. When families communicate these details, they help the doctor make safer decisions. Improving a senior's medication plan is not about removing treatment. It is about making treatment smarter, safer, and more personalized. It is about recognizing that an aging body deserves a gentler, more careful approach. It is about preserving independence, memory, balance, and emotional well-being. It is about ensuring that the person you love can enjoy their later years with as much clarity, comfort, and dignity as possible. And most importantly, it is about understanding that aging does not have to mean decline. Many seniors regain energy, confidence, and mental sharpness simply by adjusting their medication plan. Small changes can lead to profound improvements. If you have a parent, grandparent, or any loved one over the age of 65, stop scrolling for a moment, because what I'm about to share has saved families from confusion, falls, memory decline, and even hospitalization. Hi, this is Dr. and today I'm sharing 5 medications I would never let my own family members over 65 take unless there is absolutely no safer alternative. Why? Because after age 65, the body changes dramatically. The kidneys filter slower, the liver processes toxins more slowly, and the brain becomes more sensitive to chemicals. This means a medicine that was harmless at age 40 can be dangerous at age 70. Today's episode is not fear-based, it's education, based on decades of clinical evidence and real-world experience treating seniors. So let's begin with the first medication I urge every family to know about. Alprazolam, Xanax, Diazepam, Valium, Lorazepam, Ativan, Clonazepam, Klonopin, Temazepam, Restoro. Why seniors should avoid them. After 6, the brain becomes extremely sensitive to these drugs. They cause memory loss, daytime sleepiness, confusion, dizziness, increased risk of dementia-like symptoms, and up to 3x higher risk of falls and hip fractures. Giving a 70-year-old a pill that affects them like 2 or 3 glasses of alcohol. That's what benzodiazepines do. Real-world scenario. A 72-year-old takes Xanax just to help sleep. Within weeks she feels slower, less alert, more forgetful. She begins stumbling when getting out of bed. Family thinks it's aging, but it's the pill. Why doctors avoid them. These medications stay in the body much longer in seniors. What should last 8 hours can last 24 to 48 hours, causing a constant fog. Safer alternatives: melatonin, magnesium glycinate, cognitive behavioral therapy for sleep, relaxation techniques, treating nighttime pain instead of knocking out the patient. Common anticholinergic medicines: diphenhydramine, Benadryl, hydroxyzine, dicyclamine, oxybutynin, for overactive bladder, certain antidepressants like amitriptyline, some anti-nausea drug. Side effects in seniors: memory decline, confusion, dry mouth, constipation, hallucinations, increased dementia risk, higher fall risk. Why they are dangerous. Acetylcholine is essential for memory formation. Blocking it in seniors is like turning down the brain's electricity. Example: a 78-year-old takes Benadryl for sleep. After months, her family notices she's confused, repeating questions, and seems not herself. They assume dementia, but often it's the medication. Safer options: non-anticholinergic allergy medications, behavioral bladder training for overactive bladder, low-dose melatonin instead of antihistamines for sleep. Medication number 3, strong pain medications including opioids. Common examples: tramadol, hydrocodone, oxycodone, codeine. Why they're risky. After 65, pain medications can cause breathing problems, extreme drowsiness, dangerous falls, confusion, constipation, leading to hospitalization, increased fracture risk. The hidden risk: many seniors are prescribed pain pills after minor injuries or surgeries. What starts as only for a few days turns into months, and dependence forms. Real case example: an older adult begins taking tramadol after knee pain. Weeks later he becomes confused, dizzy, unsteady, and depressed. Family thinks he's declining, but it's the medication suppressing his nervous system. Safer pain solutions: physical therapy, acetaminophen, turmeric, plus omega-3 supplements, heat therapy, Limpact, exercise targeting the cause of pain instead of masking it. Acid reflux, heartburn, gastric irritation. Common names: omeprazole, pantoprazole, Nexium, Prevacid. Danger: PP are effective short-term, but long-term use, months or years, in seniors leads to calcium loss, magnesium deficiency, vitamin B12 deficiency, kidney disease, weakened bones, higher risk of pneumonia, higher risk of gut infections. This happens. Stomach acid isn't the enemy. It's necessary for digestion and vitamin absorption. Blocking it for years disrupts everything. Safer, long-term solution: lifestyle changes, meal timing, smaller meals, weight loss, avoiding trigger foods. Taking PP is only short-term. Medication number 5, NSAIDs, daily anti-inflammatory pills. These include ibuprofen, naproxen, diclofenac, indomethacin. They're risky for seniors. Long-term NSAID use causes stomach bleeding, kidney damage, high blood pressure, heart failure, worsening dangerous ulcers. Example: a 70-year-old takes ibuprofen for joint pains. Months later, she is hospitalized for internal bleeding. This is extremely common. Safer alternatives: acetaminophen, heat therapy, gentle stretching, glucosamine, anti-inflammatory diet. Sit down with your loved one and list prescription drugs, over-the-counter pills, herbal supplements, sleeping pills, pain medications. You'd be shocked how many seniors take harmful combinations without knowing. Step 2. Ask these 5 questions. Bring this list to the doctor and ask: why am I taking this? Is it still needed? Is it safe for someone my age? Are there safer alternatives? Can the dose be reduced? Doctors appreciate families who ask smart questions. Step 3. Look for these warning signs if your loved one shows confusion, more falls, sudden memory problems, dizziness, new anxiety, hallucinations, extreme fatigue. Often, it's not aging, it's the medication. Step 4. Support your loved one. Medication changes must be supervised. Never stop a drug suddenly. A doctor or pharmacist should guide the process. Final message: if even one person over 65 watches this and avoids a harmful medication, this video will have done its job. Todd, please share this with anyone who cares for an older adult. It could truly protect their independence, their memory, and their safety. Asterisk: as people cross the age of 65, their bodies begin to change in ways that make medications affect them very differently than before. Most families don't realize how aging alters the way drugs move through the body, how they are broken down, and how strongly the brain responds. The liver, which is responsible for processing most medications, becomes smaller and receives less blood flow. This means drugs that used to leave the body within a few hours may now remain for double or even triple the time, creating a stronger and longer-lasting effect. At the same time, the kidneys, which filter the blood and remove toxins, begin to slow down. Because they cannot clear medications efficiently, drug levels can build up silently, turning a normal dose into an overdose without anyone noticing. Meanwhile, the aging brain becomes more sensitive to chemicals. A pill that once caused mild drowsiness can now trigger confusion, memory problems, or sudden dizziness. This sensitivity is one reason why medicines like sleeping pills, anti-anxiety drugs, antihistamines, and painkillers can become extremely risky for seniors. Another major change is the shift in body composition. As older adults typically lose muscle and gain fat, many medications get stored in fat cells. Instead of leaving the body quickly, they accumulate gradually. This slow buildup causes seniors to experience stronger side effects over time, even if they are taking the same dose every day. Add to this the fact that most adults over 65 take multiple medications, prescriptions, pain medicines, supplements, sleep aids, allergy pills, and the chances of dangerous drug interactions increase dramatically. A single unsafe medication can start a chain reaction that affects mood, sleep, balance, and memory. Asterisk: